Hi Luigi, my name is Marianne. I'll be your nursing assistant student today and I'll help you brush your teeth. Is that okay with you?
Yes, ma'am.
Very good. I'm going to have your visitors step out. I'm going to wash my hands. And I'm going to check your ID. Can you give me your first name and your month and day of birth?
It is, my name's Luigi and it's February 2nd.
Thank you. I'm going to check your bed locks just to make sure your bed doesn't run away. And I'm going to pull your curtain as well. I'm going to collect my supplies. So I have a barrier to put your supplies on so that I have a clean surface to work on. I have a clothing protector. If I need to go to the sink to get my water, I want to make sure that I get that before I put the bed up. I also have a basin, toothpaste, mouthwash, a clean toothbrush, and I'm also going to get myself a pair of gloves. At this point in time, I'm going to raise your bed up, so don't be frightened. And I'm also going to put the head of the bed up all the way up. So I'm going to put the height of the bed up just a little bit. And then the head of the bed up. And I'm going to put the head of the bed up all the way. If you don't put the head of the bed up all the way on the state test, you might not do so well. So I'm going to readjust your pillow as soon as we get you all the way up, okay? Okay, can you lean forward for me, please? Is that a little more comfortable?
Yes, ma'am.
Okay. Is it okay if I put this clothing protector on you?
It is okay.
Now keep your clothes clean. Okay. So here I have a nice new toothbrush for you. I'll put some water on the toothbrush. And you only need to put a little bit of toothpaste on. You don't need a lot of toothpaste. Sure that I have all my supplies ready. Are you ready?
Very.
Okay, so you open your mouth. I'm going to brush gently, making sure I get all the surfaces. I'll go to the other side. Brush all the surfaces. Can you open your mouth for me, please? I'm going to brush the insides of the teeth surfaces. On the upside as well. Sorry if it tickles. And would you like me to brush your tongue? Okay. At this point, I have water for him to rinse. And you can spit. Is that enough for you?
Yes.
Okay. I'm going to use the clothing protector to wipe his mouth. Make sure that it's clean and dry. Okay. Your teeth feeling okay?
I feel great.
Would you like some mouthwash?
Yes, please.
Okay, and I'm just going to dilute a little bit of mouthwash here. It's up to you whether you want to have mouthwash or not. You can refuse if you don't want it. So here's mouthwash. Go ahead and rinse and spit. Would you like more?
No, I'm good.
Okay, and then I'm going to wipe your face and make sure that your mouth is clean and dry. I'm going to go ahead and remove that clothing protector. And that's going to go directly into the laundry. At this point, I'm going to put your bed down too so that you're safe when I go and rinse your basin. So don't be frightened about the bed going down. Would you like the back of the bed down or would you like to keep in the sitting position?
The sitting position.
Okay, great. I'm going to go clean up and then I will be right back, okay?
Yes, ma'am.
So I take my supplies. Anything with water in it, the water is going into the sink. The cup, the toothbrush can go into the trash. I'm going to use a barrier to open the tap, rinse out, and turn it off with that same barrier. And because we used it on a bodily person, I'm going to actually use disinfectant. Hold on to the dish with one. Dry the inside with one towel dry the outside with another towel. Since this one's a little wet, I'm going to switch it. I'm going to take an extra paper towel to put my supplies back in my basin. And I can also use this same paper towel to open the drawer to return the supplies. At this point, I can review my exit steps, ask if you need anything. Is there anything I can get for you, Luigi?
No, ma'am.
I'm gonna make sure your bed is lowered, and it was lowered. Make sure that that's comfortable, and you wanted the head of the bed up. I'm gonna make sure your call light is in reach. Which is your strong side, Luigi?
My right hand.
Okay.
Thank you.
Would you like a drink?
No, thank you.
I'm gonna examine the overbed table. Make sure that it's clean, dry, and in reach so that you don't fall out of bed. Break a hip, have surgery, get an infection, and die. Laundry into the laundry basket. At this point, I'm gonna fling back my curtain, and so I don't contaminate it more, I'm just using my arm. Remove my gloves, and I'm very careful to not contaminate myself by the way I take off my gloves. Wash my hands. Invite your family back in, and jot down any charting I might have. Thank you, Luigi.
Thank you.